Hi everyone, my name is Latika Satish Kumar, and today I'll be presenting my research on the increasing influence of artificial intelligence in radiology with a focus on MRI, PET, and CT imaging. I also wanted to thank my research mentor, Mr. Suraj Pavagada, for helping me throughout this whole research, whether that's through my literature review, resources, sources, citations. I really want to sincerely thank him for guiding me throughout this whole mentorship. I really appreciate it. Also want to thank STEM for the Future for making these opportunities for students like me to be able to research with professionals. So let's get started. So before going into the main content of this whole research paper, I wanted to start with a little abstract that I used in my research paper. So if you didn't know, artificial intelligence is rapidly transforming healthcare, especially in fields like radiology that rely heavily on data. Radiology involves analyzing medical images to diagnose and monitor disease within patients, which makes it an ideal area for AI to kind of come in and integrate through that. And so in my research, I explored how artificial intelligence improves image quality, reduces scan time, and supports more accurate diagnosis, while also considering current limitations like, of course, bias and ethical reasons. So now let's get into what is AI in radiology. So AI in radiology uses machine learning and deep learning algorithms to analyze medical images and identify patterns. These systems are kind of trained on large data sets, allowing them to detect abnormalities that may be difficult for humans, doctors, nurses, healthcare professionals to kind of recognize. And AI really doesn't replace radiologists, but it supports them by making the scans and the images more faster to recognize, more consistent, and more accurate so the patient gets the best care that they are able to receive. So now let's talk more about artificial intelligence in MRI. So as everyone knows, MRI is widely used because it provides detailed images of soft tissues without radiation. However, traditional MRI scans can, of course, be time consuming and are often affected by motion or even noise. And how AI is integrated to this is that it can enhance image reconstruction, also reduce noise with patients who might have claustrophobia when entering that tight space, and also correcting motion artifacts. And this allows for faster scans while maintaining high image quality. AI-based reconstruction techniques can also reduce scan times by up to 60% while maintaining or even enhancing image quality. And this is just really incredible what AI can do in MRI. Without further ado, let's talk more about AI in PET scans. So, the impact of PET scans is really significant. PET scans are used to visualize metabolic activity, which is really especially important for detecting diseases like cancer. But, however, PET scans can, of course, be noisy and less precise. So, the way that AI kind of comes in and helps radiologists is that AI can reduce noise and enhance image clarity, allowing for more accurate interpretation and better tracking of that disease progression. AI also expands what PET imaging can do, so it improves detection and localization of disease. It supports early diagnosis, like I mentioned before. In addition, emerging research shows that AI can generate PET-like images from those MRI data, which could also reduce radiation exposure and the need for multiple scans. So now let's talk about AI in CT scans. So again, CT scans are widely used, especially in emergencies, because they provide fast and detailed images. However, they use ionizing radiation, and AI helps address this by improving image quality while reducing radiation dose, allowing clinicians and radiologists to obtain clear images more safely. So, different studies show that AI can actually reduce that radiation exposure by over 60% while maintaining high diagnostic accuracy. And so, this makes CT imaging more safer for patients without compromising the quality and the best care needed to be able to support and provide for those patients in need. So now let's talk about the comparative analysis between MRI, PET, and CT scans. So when comparing all three, AI improves each in different ways. So in MRI, it reduces scan time and improves image quality. In PET scans, it enhances metabolic imaging and disease detection. In CT, it reduces radiation while maintaining accuracy. And overall, AI improves efficiency, accuracy, and workflow across radiology. And so this is basically an image that I have used in my research paper, and this just basically kind of intervenes, MRI and PET scans, and also CT scans as well, just to see how they are able to be integrated within a patient's care. And if you can see here, it just tells you how there's different scatter corrections and using different tools within AI for each scan helps better improve patient diagnosis. So now let's talk more about limitations and challenges. As everyone knows, despite its benefits, AI definitely has limitations. It requires large, high-quality data sets, which can be difficult to obtain, and biased data can affect accuracy, and many systems lack transparency, making it hard to understand how those decisions are made. But there are also broader challenges in implementing AI in clinical settings, and those include patient privacy concerns, differences across various hospital systems, and the need for proper validation. But addressing these challenges is essential for safe and reliable use. So, now talking more about the future of AI in radiology, it is very promising. So, with continued research and collaboration, AI is expected to improve accuracy, efficiency, and personalized care, eventually becoming a standard tool in medical imaging. And to wrap things up, artificial intelligence is transforming radiology by improving image quality, diagnostic accuracy, and efficiency. While challenges do still exist, AI has strong potential to improve patient outcomes and support radiologists and clinicians. And ultimately, we believe that AI isn't replacing radiologists, it's empowering them to provide the best care possible for their patients. And references can be found in the research paper, which of course will be linked on the STEM for the Futures website. And I want to thank everyone for listening to this video presentation. I hope everyone learned something new today. Thank you.